I personally invested around 100,000, and then we fundraised 210,000. We are planning to go in the direction of building out the first AI native EHR. At some point, we have tried faxing, although we haven't really done a lot of that. Really, our area of focus is going to be this fragmented ambulatory market, because there's huge opportunity there to essentially unify them. The top company has maybe 10% market share, but then a ton of other companies have 1%, 2%, 4%.
This is Axiom Alpha, where we talk about building and investing in businesses with unfair competitive advantages. You're about to make a lot of people, I think, either feel insecure or inspired, because you're both a medical doctor and have a PhD in computer science, and now you're running a health tech AI startup, which in my opinion is probably the most lucrative industry to be in. And you went to Duke, which I was also in a math PhD program at Duke for 3 years, but then I dropped out. And my advisor was actually in math and CS, and he collaborated with biochemists. So I'm surprised I never ran into you at Duke while I was there, because we overlapped by a couple of years, I think.
We probably did.
How long did it take you to get your 2 degrees?
It was 8 years. I spent 5 years on my PhD and then 3 years on medical school, which was possible because Duke has a research year built into their medical school 4-year program. So that got absorbed into my PhD.
And so does that include a residency also, or just the degree portion? And then if you wanted to go to like a hospital, you'd have to go to do residency as well?
The residency part is separate. So I did the MD degree and the PhD degree, and that was the 8 years. Residency, which I actually decided not to do, would have been an additional 3 to 7 years, depending on the field.
I think what you're doing now is cooler. SciDoc, have you guys raised money?
Yes, we have raised money. As a founder, I invested a chunk of my own money, and then we've also done some family and friends, local physicians, fundraising in our area, and that's what's been supporting us up to this point.
Gotcha. So no VCs yet, just angel investors, basically?
Exactly.
And how far along are you guys? When did you guys start the company? And I guess, did you start it by yourself, or I saw you have a few team members listed on your guys' website?
Yes, so I do have a team. I am the only founder, but I am working with a really great team of engineers and marketing experts and regulatory experts. So I have a lot of great people working with me on SciDoc. And in terms of when I started, how long I've been working on it, the timeline is interesting because I technically started the company back in 2019 when I was still in my training program, but I was obviously working on that part-time because I was mostly just getting my degrees. So really it's been about a year and a half that I've been focused full-time on the company, and that was since I graduated back in spring of 2022.
I imagine you must have pivoted in that time as well, because looking at your website now, I get the impression that you are a generative AI company. This intro note generation. Were you using generative AI back in 2019, or were you using something else or pursuing a different idea and pivoted into this?
So we have always been in the generative AI space, although I will give the caveat that for those of you who are listening with a lot of AI technical background, we're not doing generative AI with the types of models that most people think of when they think of generative AI. So my PhD was focused on machine learning, and I did do a lot of work in both computer vision and natural language processing. And I have a very deep understanding of these large language models that have been recently taking the world by storm and are very popular in startups nowadays. But interestingly enough, we are actually not using that type of model for our note generation. We do generate medical notes, but it's with a kind of different type of AI technology that, based on my background, is better suited for the particular problem we're solving right now.
Interesting. And it was that choice of using a different model because that's what you were already working on before, all of this, GPT hype started, or was it for a technical reason, like it's less prone to hallucination, or it's more controllable in some ways that you can, ensure that you're actually producing an output that's appropriate to a medical field?
It was the technical reasons. So you hit right on with the hallucinations. That was one issue we were concerned about and wanted to avoid. And then also issues of bias. A lot of times these large language models have just tons of inbuilt biases, and we didn't want that to be part of our particular medical niche application at this point, because what the purpose of our product is to basically generate a medical note before an appointment has started, and that enables the appointment to be more streamlined and also saves the doctor on note writing time, can be up to 3 times faster, which is a huge time savings compounded across days, months, weeks. So we wanted to make sure that everything that the patient reported to us is perfectly represented in terms of factual accuracy in the note we generate, and also that the note sounds professional. So we came up with an alternative technology that is able to accomplish that in a really computationally efficient and reliable way.
Very cool. Is it still based on a transformer or is it something else?
It is not a transformer. It is actually a very sophisticated expert system paired with a knowledge graph and some proprietary graph traversal algorithms that we developed for the purposes of doing the questionnaire interviewing process and the text generation.
That's very cool. I'm curious also, your website describes this AI generated input form, and I'm not sure exactly what that means. Is it, AI generated in the sense of I know something about this patient, so I give them one form knowing what I know about their background? Or is it I serve them up a starter field, they input something, I then produce a second field and then iterate that way?
It's an interactive process throughout. So from the patient experience standpoint, what it's like for the patient is that first, we have basic information like name, date of birth, just so we know who they are. And then when we get into kind of the meat of the application, we first start out understanding why is it that they're coming into their appointment. And right now, we're primarily focused on family medicine and obstetrics and gynecology, although our technology itself, we are intending to expand into other areas. So we start out basically with why are you here? And we have an interface where there's some things that are sort of pinned front and center for like common reasons that people would go see their doctor. And then we also have a way of the patient just typing in why they're coming in, and then we can, behind the scenes, match them up with where the form should take them next. And then from the patient standpoint, what they will see is they'll see questions that are very specifically targeted to why they said they're coming in. So for example, if someone's coming in for diabetes visit, then they're going to see questions that are asking them things about, are you doing home blood glucose monitoring? And are you experiencing any of these kinds of relevant symptoms? And have you had a foot exam? Stuff like that. Whereas if they're saying, say they're coming in for difficulty sleeping, it'll be a totally different kind of line of reasoning. And so the patient experience is they're getting asked these questions that are targeted to them, and then at the end they just submit it, and it takes them 3 to 5 minutes to complete, and then they're done, and then the doctor gets the generated note after that.
That's very cool. Does this fall under any sort of regulation? I would imagine it falls under some, but probably not as much as other areas of health tech.
We do have to be HIPAA compliant, high-tech compliant, make sure that we're taking patient privacy very seriously. And so we are HIPAA compliant. We've worked with a HIPAA compliance group to ensure that everything is set up very securely. We do have Amazon Web Services as our one of our backends, the backend that handles patient data. So we have that configured to make sure everything is secure and properly set up. A lot of times, if you're doing something in the diagnostic space, then there's a whole bunch of additional types of regulatory steps you have to take. At the moment, we're not doing anything that's diagnostics.
And is that the same, are you basically in the same regulatory regime as like basic medical records, like EHR systems?
Yes, exactly. So different types of regulations that apply to EHRs also apply to us in terms of protecting patient data. There is, for EHRs specifically, this ONC certification program that you can go through to get ONC certified if you're kind of a full-blown EHR. And that is actually a direction that I'm really interested in taking my company, a kind of AI native EHR. So at the point at which we get there and where we're offering an EHR product, then we would get ONC certified and go through those extra steps.
Yeah, I was curious about that. I saw on your website you said you basically you have to copy and paste from the output of the input form into an EHR system. And I was wondering if you were planning on partnering with EHRs as distribution channels, or if you were thinking of, going after and eating their lunch. It sounds like you're trying to eat their lunch, which is good. I approve.
Yeah, so our strategy is we have a couple facets to it. So one is that, so you're correct. Right now, it's a copy-paste interaction where the notes appear in our web portal and then they can be pasted into an EMR. At the moment, we're not planning to integrate. And actually, one of the main reasons there is that there's something on the order of 500 different EHR vendors in the US. And while there are some really, really big players that have huge chunks of the inpatient market, in the ambulatory setting or outpatient setting where we're focused, it's really much more fragmented, where the top company has maybe 10% market share, but then a ton of other companies have 1%, 2%, 4%, huge mixed bag. And we wanted to make sure that what we built out is something that anybody could use regardless of EHR. And that's why we have the current system where it's just a one-click copy paste. It doesn't matter if you're using some EHR from like 30 years ago, you can still benefit from our technology. And then the other aspect of it is that ultimately we are planning to go in the direction of building out the first AI native EHR. So in that sense, we're going to integrate with ourselves.
That's so interesting. I had not heard that. So what is the market concentration? You said you're in an outpatient, meaning I thought earlier you said family medicine. So forgive me, I'm not a medical professional by any means. I'm not that familiar with the details of the industry. When I think outpatient, I think of like addiction recovery. What is included in outpatient?
So outpatient is any time that you're interacting with a healthcare provider, not as an admitted patient in the hospital. So the majority of interactions that most people have with the healthcare system are outpatient. That would be like if you go see your family doctor, or if a kid goes to see their pediatrician, or if a woman goes in for a prenatal visit. All of that is considered outpatient. Inpatient would be if you have cancer or something and you need to go in for a couple weeks because you are experiencing some complication. Or inpatient would also be if you have some complex surgery that has to take place and then you're going to be in the hospital for a few days after that getting monitored and recovering. That would all be inpatient. So we're right now, any outpatient type of setting, we can really benefit in terms of the workflow there with the note generation. And then for our initial target areas, narrowing it down more specifically, family medicine is one area, as well as obstetrics and gynecology. So I hope that helps clarify a bit who we're initially targeting.
Yeah. Can I ask why obstetrics and gynecology as your first subset? Is that the area where EHR is the most fragmented, or is it the area where they spend the most time on intake?
So for family medicine and obstetrics and gynecology, we found that there's a lot of need for note writing support because the notes can take up a lot of time. And they're also both areas of practice where the patient population is likely to be able to interact successfully with our technology. So for example, we did not have geriatrics as our number one target category because an older patient population is not as likely to enjoy filling things out on a phone. Diving in more detail specific to SciDoc and specific to our product, we honed down further based on having conversations with lots of different doctors about specifically our product and doing a demo, getting feedback. And
how many iterations did you go through of testing? And where did you find these tests? Like, do you have a background of a lot of family doctors, or was it all people that you found through Duke, or did you just do cold outreach? And
it's actually been mostly through cold outreach. I do have contacts through Duke where there have been specific people at Duke where I've gotten their feedback, but Duke is, it's a huge hospital system, and we are not initially targeting huge hospital systems as our customers, mostly because there's just a really long sales cycle. So as a startup, we want to be able to move more quickly. Most of the iterating has actually been based on private practices that I found through cold outreach.
And how many practices have tested your product now?
We have gotten really detailed feedback from over 10 practices, and then in terms of who we've onboarded as formal clients, we have 2 practices. One of them is a family medicine practice that's based here in Durham, where SciDoc is also based, and then another practice is an obstetrics and gynecology practice that's based down in Florida.
That's exciting. I think a couple of weeks ago when I first reached out to you, you said you were about to get the first paying customer, so now you have 2. That's exciting.
Yeah, so they're, I guess for full disclosure, they're currently in their free trial period, but they, our goal is obviously they will convert to paying customers after the free trial.
And so I guess in terms of business model, it's a free trial as opposed to like a freemium where they have a permanent free tier and then there's some upgrade.
Yeah, so we have initial free trial followed by the software as a service model. So they pay a monthly subscription, currently priced at $99 per clinician per month. So that way there's some scaling with the practice size, but it's easier for the customers to grasp rather than when you get down to the level of talking about pricing per patient, people tend to get somewhat, they try to do too much mental math.
And how long is the free trial period that practices get before they have to commit to paying?
So for our first 2 customers, it's a bit longer, but going forward, it's going to be 2 weeks.
What are you doing for the first customers? Like a month, 2 months? 2
months for the first 2. They get a special deal for joining us early on.
Despite being not a hospital sales cycle, still it's got to be some friction in getting a doctor's office to adopt a new technology. Like, how does this even integrate with their existing system? Is it completely separate? I mean, they have some sort of scheduling system presumably in place. And so at minimum, I imagine you have to integrate with their scheduling system. How does that work? How much effort is it to integrate with a practice's existing systems?
We have a couple different options that make it really seamless for practices to start using it. One of the options is that we're able to generate basically a unique URL for their practice. And a lot of practices do have these scheduling systems where a lot of times the scheduling system is already going to be sending patients reminder emails and whatnot. So one of the options that we have available is they can insert that link into their reminder email to tell the patients, hey, please fill this out before your appointment. And then the patient just gets the link and they can click on it from their phone, a tablet, their computer, really any device at all. But we've put a lot of thought into making it as quick as possible for practices to do the setup. So really the actual setup process itself generally only takes like 5-10 minutes.
Is the link, is that something they have to copy and paste into an outgoing email, or is the scheduling system an unfragmented market where there's like 3 players that account for 80% of the scheduling systems, and so you can just integrate with those and put your link into the outgoing email that's coming from those systems?
There are a lot of different types of scheduling systems that practices have, and the capabilities of them do vary a lot. Sometimes the scheduling is built into their EHR. Sometimes the scheduling is built into some practice management software they're using. It really depends on the practice. But in the situations where their scheduling software is sending out these reminders, there's typically an option where they can customize the message. And so it's pretty straightforward for them to just paste the link into that customized message.
So they still have to manually, though, like paste it into some outgoing message. The scheduling system doesn't automatically send the email out?
A lot of the scheduling systems will have templates. So if you paste it into the template, then it's sort of a one-time thing. And once you save your template, then that will get sent out to all the patients. Right now, since our note generation is really focused on kind of the meat of the visit in terms of whenever you have a patient come in, there's kind of routine things like family history, and that doesn't change very much from visit to visit. And then there's sort of the meat of the visit, which is like, oh, today the patient has a cold and that's why they're coming in. Or, oh, the patient's been having headaches lately and that's why they're coming in. Since we're really honed in on that specific reason, that's where our focus is. It applies equally to new and existing patients because they're always going to have some reason that they're coming in. Even if that reason is like annual physical exam, we have specific questions that we ask associated with an annual physical exam. So it works in either case. And one thing that we're interested in building out in the future is something where for maybe collecting more routine information where we'd be able to load that in for returning patients and have them do updates to it.
So put me as a fly on the wall when you're making these cold outreach. Are you cold outreaching via email, via phone? Like, I feel like this is kind of a black box for a lot of entrepreneurs who find the health tech area interesting and they are not from healthcare. They have no, they don't have an MD. They never worked as a doctor. How does the sales process go? What do you say? What rejections are they giving you?
Yeah, it's a great question. So we're doing a variety of things. With cold emailing, some practices will have an email that's listed on their website. Sometimes they won't. If they don't have an email listed, sometimes you can call them on the phone and get an email. There are some practices out there that are still fully paper, in which case those are not our target customers. So we just make a note of it. They're all paper. They're not the best fit. But I would say a good majority of practices will have an email or phone number that you're able to reach them by, potentially by both. At some point, we have tried faxing, although we haven't really done a lot of that. But I will say that is like one thing that I think every practice has is they all seem to have a fax machine. And then sometimes we've been able to find practices through LinkedIn as well. So sometimes practices will have LinkedIn pages, or they'll have lots of their employees or their practice owners. Sometimes they'll have LinkedIn pages, and we'll have been able to reach people that way too.
Would you say email is overall the most effective, or is LinkedIn equally good for reaching doctors?
Yeah, I think they've been about equivalent for us. I think to some extent it depends on who it is that checks the email at the practice, and that unfortunately that's not something that we haven't been able to find some indicator on the websites of saying like who's going to be checking the email. So most of the time it's an administrative person, but sometimes it's different administrative roles that will be checking the email, and then sometimes the doctor themselves will check the email. It really depends. But yeah, I think for practices, really, I think a multi-pronged approach is most effective because different practices appear to be responsive to different types of strategies. And it's hard to say beforehand just from looking at their website what they're going to respond to.
So what is your initial outgoing email?
We'll actually usually try multiple tactics simultaneously, and then we try to keep the emails very direct and to the point. We like to assume that even though it's unlikely the doctor will be the one reading it, we like to write it as if like, well, if the doctor were the person to read this, are they actually going to have time to read through the whole thing? So we try to make sure it's not too long. We basically summarize, this is who we are, this is what we've made, and then invite them to contact us for more information or a demo, and then see what they say. And typically when they're interested, they're very clearly interested, and then we just proceed from there.
When they're hot, then they give you a good response. It's typically right off the bat. It's not like you have to follow up 5 times and then finally they get around to responding.
In our experience, most of the time, the people who are really interested are just solidly interested and they just go for it. And we have also had some people where they just want to learn more, and then we have a couple interactions with them and then they become more interested. So it depends. I think the number I heard is something like, on average, you have to contact someone 13 times before they want to buy your software product. So I don't know if we've had the 13 times yet. I think there are practices that we've reached out to multiple times. I don't know if we've hit 13 for all of them, but I guess I'll let you know when we're further along what the magic number is.
I imagine it's strongly dependent on what you're trying to sell too. If you're solving a problem that's a particular pain point for gynecologists and they just spend a ton of time on intake, then it makes sense that they would be a bit more responsive to that.
Yeah, I think doctors are definitely really excited about saving time on their notes because the technology that SiteUp has is really unique in that it's essentially abstracting part of what would normally be the doctor-patient conversation and just automating that and putting it before the patient even is talking to the doctor. And that means that a lot of the time, if you think about like from the patient's perspective, like all of us have been patients, all of us have gone to see doctors, and most of that conversation is the doctor trying to suss out exactly what's going on by asking questions. So if we can take a chunk of that and have it done beforehand, then that means the visit itself can be faster, or even if the visit takes up the same amount of time, it just frees up all this extra time for maybe the patient is the one who gets to ask questions instead of the appointment just being this super rushed information gathering moment.
I'm curious, have you thought about having an image aspect to that as well? Like, I would imagine there's I don't know what the percentage is, but a decent percentage of cases where someone's coming to the doctor with some, I broke my arm. I guess maybe not gynecologists, but, if I have a lot of kids as patients, then it's like, I have this big gash, I need stitches, or I broke or sprained something. And then if you can include an image in that initial form, I injured my arm, here's a picture, send that, that would probably also be pretty helpful. Is that something on the roadmap or not? Not so much because there's other things to tackle?
I've definitely thought about images and different ways to incorporate images. I have a lot of imaging background during my PhD. I did a lot of work on 2D images, 3D images, dealt with a lot of medical imaging specific formats. So it's definitely an area that's near and dear to my heart. I think with our current product, we're not going to be integrating images in the short term, but I will say that for potential future applications in, for example, triage, where maybe a patient is trying to decide, do I need to go in to see my doctor, or do I need to go see my my primary care doctor who's in family medicine, or do I need to go to the emergency department, or do I need to go to an urgent care? If we had a future application like that, then I could certainly see having an image, images maybe more than 1,000 words when it comes to certain things. So there's definitely potential in the future for having an image component.
Yeah, I can't remember the name of the company, but I know there's at least one company that I think markets their service to businesses, and their pitch is basically, hey, business, pay $3 or $4 per employee per month, and your employees can then text pictures of injuries or just text out, this is what's up, I'm feeling this way, and then the doctor can be like, oh, you should probably come in, or, you need this prescription. I guess it's the intake without the actual doctor's visit. It's just here's sort of my problem, and then tell me whether or not I have to come in. You could take them on too.
That could definitely be an interesting application. I mean, it is a really important question. Like if a health issue comes up for somebody, they need to know what are they going to do with it, and having some way to digitally connect with some system or person who can give them that advice in the moment, whether it's based on a picture or based on some text information they provide, that has a lot of potential utilities.
In fact, maybe you could be the Shopify to that business's Amazon. Like if that business is a single provider, all the providers are aggregated under this one company, and you already are establishing this intro relationship to all these small practices, then you could say, hey, small practice, by the way, do you want to add an extra revenue stream by providing opinions? And then you can have your AI provide them with a summary, or just pass through the message directly, and then they can provide an opinion or tell them that they need to come in, and then you can charge them a percentage of whatever revenue they get that way as well.
Yeah, I definitely agree with you. That could be definitely exciting.
Do you know how big is the overall medical records market?
Yeah, in the US, it's I believe around $12 billion, and also growing pretty rapidly. You know, if you're talking worldwide, it's even larger. Right now we're specifically focused on the US.
Who are the biggest players in the HR space currently?
The biggest player is Epic. They have large percentage of the inpatient EHR market, as well as a chunk of the outpatient market. And then there's also, Cerner, Meditech, Athena Health, ECW, or eClinicalWorks, and then several other ones. So on the inpatient side, there's much bigger pieces of the pie taken by big companies. And then on the outpatient side, where SciDoc is focused, I believe the top EHRs are ECW and Athena Health. And then after those, it's more like 4%, 3%, 2% of the market for a very long tail of other EHR companies. So what part of our strategy is that when we have our EHR, that's our area of focus is going to be this fragmented ambulatory market, because there's huge opportunity there to essentially unify them under an EMR that is essentially built from the ground up with AI in mind.
When you say ambulatory market, I presume you're not talking about ambulances.
Oh, yes. Okay, sorry. I need to get better about not using lingo. I'm working on it. When I say ambulatory, that's like a synonym for outpatient. So like the whole non-hospital market, like all of the clinics that are separate from hospitals.
Gotcha. Okay, that makes sense.
Yeah, I guess it's ambulatory because I should look up the etymology of this, but I'm assuming it has something to do with, like, if you can get up and walk around, then you're like well enough to not be in the hospital.
Right.
Maybe that's where it comes from.
I find distribution strategies are often a thing that can catapult a business forward or hold it back. Obviously, you're on the cold emailing campaign right now. Have you guys thought about any ways that you might be able to accelerate that? Like I mentioned at the beginning of this, was if you weren't trying to go after the HR market, maybe it would make sense to partner with EHR. If you're going to go after EHR, could you go to the scheduling software company and say, hey, we have this widget. Can we bundle with you? You offer it as an option when the doctor comes in, they're purchasing the software. You say, add on for an extra $100 or $50 if you want to discount it or whatever. And then, you rev share. Have you thought about doing some sort of partnership like that to get distribution faster?
Absolutely. That is something, especially over the past month or so, we've been thinking a lot about different types of partnership strategies and different kind of categories of organizations that we might be able to partner with. We haven't actually initiated any partnerships yet, so I wouldn't be able to comment on sort of past experiences of how that's gone, but I totally agree with you. I think partnerships could be a really promising way to reach more practices.
What is your guys' run rate right now? Like how much money did you raise already? And then how long do you think that'll last you?
So I personally invested around 100,000, and then we fundraised 210,000. And then we're currently doing some additional fundraising right now. And also we're applying for a couple grants. So one of them is the SBIR grant through the NIH. And then there's also a couple other grant opportunities that we've identified that are really well aligned with our mission. So with all of our kind of previous fundraising, current fundraising plans for these grants, I think we're in a good place in terms of our runway.
Do you have an idea of like how long that runway is, or kind of a high degree of uncertainty because the spending is going at different rates? Are you doing active hiring or no?
So we have a interesting structure right now where there's people with different levels of involvement. So, I mean, I'm obviously working full time, and then there's a couple other engineers who are either working crazy high amounts of hours if we have to get something done quickly, or fewer hours and lulls in between. And then there's a handful of around 10 other people who, when needs come up, they're involved. So on the regulatory side or on the design side. So we have a flexible setup right now that kind of lets us work well with the resources that we have, if that makes sense.
I'm actually super curious about this. Like, if you could elaborate on the structure. Like, so you said you're the only founder. Do you give shares to employees, or do you have vesting schedules there? Do you have advisor shares for some of these regulatory advisors or industry professionals that are helping you?
So we fundraised with SAFES. And then I've actually been compensating everybody just by paying them directly. And I don't know if it's like a chicken and egg thing.
That's great. I mean, that's conserving money.
Yeah. Like it might be like a chicken. I don't know if it's a chicken and egg thing where like the fact that we pay people in money rather than equity automatically draws people who would rather be paid in money than equity or what. But basically, like the team that we have now consists of people who prefer just being paid directly for either their time or their particular contribution if it's project based. So that's what we've been doing, and it's worked well for us.
Do you have advisors? How have you navigated the regulatory landscape?
Yes, so we do have advisors. There's advisors kind of on the business side, like with lots of startup experience, and for them, I basically buy their time. And then there's for HIPAA compliance specifically, we worked with Eagle Consulting Partners, and Gary Pritz is the founder of that group, and they are really great. So if anyone out there, you need people to help you with your HIPAA compliance. They did our risk assessment for us, helped us with our policies, gave us tons of feedback on that entire landscape. So we've had a good experience working with them.
I love that. That's avoiding diluting your cap table. Do you anticipate raising money from a wider pool in the future, or are you pretty much? You said you're raising a little bit more right now, but do you have an upcoming fundraising round that you anticipate?
Yeah, so I anticipate in 2024 we'll be doing some additional fundraising, and I do ultimately plan to do bigger, larger fundraisers as we continue to progress.
Awesome. Well, I'm curious to see how your journey goes. I'll definitely be following up from time to time.
That sounds great. Yeah, and thank you so much for the opportunity to be here today.
Yeah, thanks for coming.